comes to this. Okay. Now, some terminologies you should know and classification. Gingival enlargement, you can say, or gingival overgrowth, you can say. Then it can be interchangeably used with the hyperplasia, hypertrophy, and fibrosis. What is hyperplasia? Hyperplasia is the increase in the number of cells in the tissues. Okay, that results increase in tissue volume, but hypertrophy is actually increase in tissue size and result in increase in cell size. Very important. Okay, so hyperplasia when the number of cells increase, and hypertrophy when the cell size increases. Okay, now basically they are saying that but the mechanisms of hyperplasia and hyperplastic are different, but they can also occur simultaneously when cellular involvement in the hyperplasia most likely triggers the overgrowth. Okay, means in hyperplasia when the patient have the hyperplastic gingiva, so it is basically due to triggers the overgrowth of gingiva. Okay, the two processes that are closely linked is basically fibrosis. Fibrosis is a pathologic process, means it disrupts the wound healing, means it does not allow the wound healing properly, and due to which there is a defective cell proliferation, means the cell do not properly proliferate. Cell to cell interactions are not properly happen. Cell to matrix interactions are means the cells are not properly attached to the matrix, and there is a defective matrix deposition with an impaired immune system response, mean the immune system does not respond properly. Fibrosis is basically a pathologic lesion, but hyperplasia and hypertrophy is a pathologic process. Okay, now basically the gingival tissues can be associated with various phases of the inflammation like a hyperplastic, hypertrophic, and fibrotic changes during the gingival enlargement. Okay, but you cannot say properly or differentiate it that this is due to fibrosis or hyperplasia or hypertrophy this overgrowth has happened. Okay, so basically now there's a classification which is based on the etiologic factors. The most common, if in your MCQs or in your viva someone have asked you what is the most common form that results of the gingival enlargement, is due to medication. Drug induced gingival overgrowth is very common, and three groups which is involved in them is anti convulsant, gingival calcium channel blockers, and immunosuppressants. Okay, conditions like leukemia or genetic factors, and those conditions which cannot be classified among the gingival overgrowth is basically idiopathic. Sometimes it can also be due to the inflammatory changes that occurs due to gingivitis. Okay, the classification of gingival overgrowth is like drug associated with systematic conditions, diseases, and gingival uh, fibro, fibromatosis. Okay, sometimes it can be also associated with the underlying osseous structures. Okay, now basically they are saying that the for proper treatment you should identify the cause and confounding etiologic factors, so you will do the proper treatment of that overgrowth, because there are different forms of gingival overgrowth. Okay,